tuned to Planet Vero Radio. I am Cindy Schwartz, and this is the Patient Partner Show. We're broadcast on 101.7 FM Real Radio, WCZR, and then this is also on a podcast on Spreaker. I've got Jeannie Roller, my co-host, is with me. She's listening in. She's in Indiana. And in the studio, I have Dr. Rich Wyderski. He is a primary care doctor, so your GP doctor in the old days. And he is also now in concierge medicine. So we're going to explain a little bit more from the mouth of Dr. Rich, who is the actual doctor, who is the concierge doctor, if you will. Kind of sounds like a Yogi Berra-ism there. And what people can expect. How can you find concierge medicine? How does that work? What's different about it as far as insurance? Do you take insurance? Do you not take insurance? Why are you giving you, in your opinion, better care, in my opinion, better care with this type of format? So, Dr. Rich, you're with us here again today. Thank you so much, and I want to hear all this.
Absolutely. Thank you so much again for inviting me, Cindy. Well, first I want to clarify the difference between a concierge physician and direct primary care, because the two are similar but not identical. My wife and I, my wife's an RN, we decided to open a direct primary care practice. So we're going to limit the total number of patients that we have. Each patient pays a $250 a month fee, but that's it. No matter what I do for the patient, no matter how many times per month or per year I see the patient, that $250 per month fee covers everything that we do in the office, including EKGs. If we need to draw blood, we don't actually run the blood sample, but we can draw the blood in our office. So anything we do in the office is all covered. We don't bill insurance for anything. In fact, I had to opt out from Medicare to tell Medicare I'm not going to be billing my patients for any professional service fee.
Okay.
And that the only thing that I'm going to be doing is collecting a membership fee, is what we call it.
Okay.
So anyway.
That's your practice, not to interrupt you, but there are other concierge doctors that format their care differently. Yeah, they do take insurance.
They actually bill insurance for their fee for service per visit, and then they also charge a concierge fee on top of that. And that there's usually some other kind of service they provide to the patient that isn't part of their regular medical practice that justifies the concierge fee.
Okay. Because people get nervous about that. They're like, oh, this is going to run into umpteen amounts of money. How is this guy going to order tests for me? What happens if I have to go to the hospital? So let's talk about that. You have a certain amount of patients. You've decided that that's what your number is. You feel comfortable with giving the best care that you possibly can. Certainly you've been in the industry, the healthcare industry, for 30 years. So you got a lot of hands-on with patients. So you know how to field all of that. So how does that work for you?
Yeah. So by being a direct primary care physician, I'm really not credentialed with any individual insurance, including Medicare.
Okay.
But I do have the ability for all patients to order whatever I need to order, and in fact, I have to have permission from Medicare to do that. We actually had to wait for 3 months to get our permission to do that.
Okay.
But I can order anything. I can order labs. I can order X-rays. I can refer to other physicians. I can have all those privileges of ordering, but I'm not billing for any of that myself as a professional fee.
Okay.
So patients still get all the other care that they need, but whatever we do in our office is just what we do in our office for that membership fee.
Okay.
And concierge physicians do the same thing because they never give up their privileges, but they have to credential and bill lots of different insurance companies. Even just under Medicare, there are all the Medicare Advantage plans that are all different now, and you have to have a pretty big billing office to keep track of all that, which we don't have to do since we don't bill insurance in our particular office.
So you stay with your patient, though, if the patient gets admitted to a hospital. So that's a big deal nowadays because now they're using hospitalists in place of your regular physician.
Yeah, and that's I think for me and my patients, I think, who have been in the hospital agree with this, is that I add value to the inpatient team, although as a primary care physician, I don't have admitting or discharging privileges, and I can't actually write the orders in the hospital. But I'm seeing my patient every day. I'm talking to the nursing staff. I'm checking out the laboratory testing. I can bring in information to the inpatient team that they may not otherwise know because they don't really have access to the outpatient record. And when my patient is out of the hospital, I can see the patient very quickly, within a few days, usually after getting out of the hospital. I also know exactly what's happened in the hospital and exactly what I need to do for the patient coming out of the hospital. So the transition from the inpatient setting back to the outpatient setting is a smooth transition, and I know what the patient needs. If I'm not in the hospital and the patient comes to my office, it may be very difficult for me to know exactly, what happened, and it takes a long time to get medical records and so forth to be able to do that.
Well, that's what we're talking about, the communication line. And also we mentioned, before we came on air, that you stay on top of, and personally I've had this problem, Jeannie, your husband has had this problem, you have as well, is the medication lists and the allergies and things like that and the tolerances for these medications. You're right on top of all of that and can intercede for the patients, I'm thinking, doctor, so they're not given things that maybe they shouldn't be given, or the doses maybe they shouldn't be given.
Yeah, that's very true. I may know about sensitivities that the patient has that isn't a quote-unquote allergy. I may have the results of testing that was done. Actually, this happened just a few weeks ago in June when I had a patient of mine in the hospital. But I happen to have the ultrasound report of the patient's heart that was just done in that very same month that the hospital physicians didn't have access to. So because it's an important piece of information, I was able to print it off and just literally hand it to the nurse of my patient. That in turn, I texted the hospital physician to let them know that I brought the copy of that ultrasound of the heart.
So you're still interacting, and it's not, a taboo for you to have conversations with people in the hospital setting. So the end result is what we were talking about all along the thread for every one of these podcasts, is for the patients to get the best care they possibly can, because that's why we started all of this. How do we do this? So you've got to ask the questions, and you have to be able to have the resources, which are, it's new to a lot of people. Jeannie, I know you said in Indiana it's kind of an anomaly that there's concierge medicine there. Here in Florida, I don't want to say we need it more than a lot of places, but that's my opinion. So it's good to know that there's an avenue going forward with this. So what do you think, doctor? How do people get good care then?
Well, it depends upon the patient's need. So,
okay.
I think, and I'm almost ashamed to admit this now, but I was in my 40s before I ever saw a primary care physician. Okay. And I wish I had known earlier, because my cholesterol was just through the roof high, even though my parents never had cholesterol problems. But apparently I inherited the right genes. So I've been going to see my primary care physician regularly for that problem. And though it's one problem, and it wasn't that big a deal, and I didn't really need a concierge physician to see my doctor maybe once or twice a year, and just get regular checkups for preventive care. So it depends upon the individual. Now, in an older adult, I'm a geriatrician. I take care of generally people that are over the age of 70, for the most part.
Okay.
And when our bodies age, we tend to get more problems. And a lot of times they're chronic problems that have ups and downs as well. So the amount of time that it takes to address those things and the number of things that we need to do to help prevent problems just goes up. And as the number of problems goes up, the amount of time it takes to address each one of those problems, of course, the total amount of time goes up as well. So my focus, not only because of my training, I've been a board-certified geriatrician since the early 1990s. My training is in geriatrics. I've been board-certified ever since the early 1990s, and that's my focus, is to take the time that I need to hopefully keep my older adult healthy, help prevent problems from happening. When they do happen, to hopefully nip them in the bud before they become major problems. And so that's the best way I can do that, is to limit the total number of patients that I have. But then I have more time to spend with each individual patient when I do see them.
Well, that's the key to a lot of this. I mean, it's my opinion. It's a lot of our opinions, certainly. The more time, and we've said it umpteen times. So you are a geriatrician?
That's correct.
Okay,
yes.
So people, if they're of that age range, there's another specific that you could look for if you're so inclined to have those kind of diseases, symptoms, whatever that go along with that kind of age bracket.
Sure, absolutely. There's even something called an annual wellness visit that Medicare reimburses physicians for if they are billing Medicare.
Okay.
But it was developed by geriatricians, and it's something I do in my office for just about every single one of my patients, to look for things that perhaps otherwise wouldn't be looked for, to prevent falls, prevent injuries,
right.
Help improve cognition so that people don't have more and more problems with with thinking and memory and so forth. So
go along with that label of, getting older.
Yeah, so we want to look for problems and see them or find them when they're minor and perhaps treatable and prevent them from getting worse rather than waiting for something bad to happen and then sometimes you never recover from it.
There you go. So prevent it before it happens. You've been listening to Planet Vero Radio. Stay tuned.